right here, right now. We're live on Facebook
Yes,
and
we
we're
are.
also live on YouTube at Love 101 FM Jamaica.
Yes, sign on, rock on, roll on. And inside Body Talk today, we do have a guest with us. We'll be talking about the rising incidence of leptospirosis. And today, inside Body Talk, we have Dr. Summer Marie Graham. I love her name, beautiful name.
Yes, such a nice
And we're gonna tell
name.
you something. We're gonna tell you about Dr. Summer real quick, and then we're gonna jump into the conversation because you know what's going on, and we want to know. We want to be informed as best as possible.
Yes, yes, yes. So
Yes.
let us go right here. So we're gonna do the bio. Can know a little bit more about her. So
Mm-hmm.
Dr. Summer Marie Graham is a Jamaican medical doctor and general practitioner trained at the University of the West Indies, Mona, and an aesthetic medicine physician certified in the United States. She works at the intersection of everyday family medicine and modern aesthetic care, combining evidence based practice with a friendly, relatable approach that patients trust. Dr. Graham has a strong interest in public health education, an interest reflected not only in her clinical care, but also in her growing presence on social media, where she creates evidence based, easy to understand health videos for the Jamaican public. Love that.
Mm-hmm.
Yeah. Now, recently,
She has been actively educating communities about leptospirosis, especially considering the increased risks following the recent hurricane. Her content highlights the disease's causes, symptoms, treatment options, and key prevention strategies guided by reputable clinical sources and Ministry of Health recommendation. Lots more to say about Dr. Summer Marie. But I'll just say this part because I think it's important. In addition to her private practice, Dr. Graham serves at the Penwood Health Center, a community clinic established through the Rotary Club and Seventh day Adventist Church, and later officially opened by the government of Jamaica, with the ceremony conducted by a big lady, this man.
yes, man,
Oh
big
man,
lady.
by the government of Jamaica, with the ceremony inducted by the Governor General, Sir Glasgow. Through this outreach clinic, she provides essential, accessible primary care services to the surrounding community. My friends, please welcome inside Body Talk Dr. Summer Marie Graham. We really hope we did you justice, Doc.
Hi,
Thank you. Yes, you did. Hi, good afternoon.
hi, good afternoon, Doc. We
Good
want to see a beautiful face. We were just seeing you, but okay, here
Sorry.
we go. Here we go.
Yeah.
All right. Yes, yes. How
Mhm.
are you doing, Doctor?
Hi, I'm okay. I'm doing well. How are you?
I'm good.
Yes,
Thank you for
okay. Yes,
asking.
thank you.
Yes. Now, something big is going on in Jamaica right now, because of what happened with the Hurricane Melissa, the aftermath.
Mhm.
We're seeing a lot of cases of leptospirosis. So, we're going to talk about it. What is leptospirosis?
Okay, so leptospirosis is a zoonotonic disease. It's a bacterial infection that is passed from the urine of an animal to humans. That's what zoonotonic means. Um, yes, that's what it is. It's caused by the bacteria Leptospira bacterium.
Okay, okay. And how does it spread?
So it's spread mainly through the contaminated water, soil, or food by the animal urine or direct contact with this infected animal. So you have common animal sources like rats, dogs, pigs, cattle, and other livestock. And the infection often occurs after flooding, heavy rains, or through work involving water or animals.
Ah, all right.
Mhm. And who's most at risk for leptospirosis? Anybody? Tell us.
So the people that are most at risk for leptospirosis are those in certain areas or certain occupations. So these include farmers, sanitation workers, fishermen, construction workers, and people that are exposed to flooded or contaminated water. Also, If you have recreational exposure like swimming, if you're wading or playing in contaminated rivers or streams, and communities with poor drainage or rodent infestations.
Wow. Okay. Now we've looked at what is leptospirosis, how it spreads, and who is most at risk. So let's talk about the symptoms. What are some symptoms to watch out for, doctor?
So it's kind of tricky with leptospirosis. So initially, the it can present similarly to dengue or to the flu. So you might have symptoms such as fever, chills, headaches with retroorbital pain, similar to dengue, as well as vomiting, muscle pain, especially in the thighs, the calves, or the lower back, and as well as you could possibly have a rash. But it may progress to a more severe illness, often known as like Wales disease or a pulmonary hemorrhagic syndrome. So these include areas that will affect like your liver, kidneys, your lungs. So you may present with yellowing to the eyes or to the skin. You might have severe tummy pain. You may have vomiting with like blood, shortness of breath. Those are some of the severe symptoms.
Mm.
Wow.
Mm.
My.
Wow. So I'm experiencing these symptoms, right? Diagnosis. Let's talk about that.
Right. He's not experiencing those
No, I'm
symptoms, but
not. Just asking
you're some
hypothetically.
right.
So these symptoms are so if you're having these symptoms, it's I would suggest that you seek medical attention. The more to what we usually do to diagnose it is usually based on the symptoms as well as the exposure history, and we can do some lab testing as well. It's either through blood or urine. But the key of importance is early diagnosis to prevent the complications, which I mentioned before.
All right. So do we have treatment for it?
So the treatment depends on the severity. So the mild cases you can benefit from just supportive care like oral fluids, electrolytes, paracetamol, that's like Panadol, and rest. So similarly to treating the flu or a mild form of dengue. However, the more serious cases may need hospital admission. So they may need IV fluids, antibiotics such as doxycycline or penicillin. And sometimes, if they are not resolving, if it is that they're having like kidney issues and their kidneys are being damaged from the infection, if they're not if they're not improving from the IV fluids, then we may have to consider things such as dialysis.
Mm. Mm.
Wow.
I, I know this is not in our talking points, but how
Mhm.
severe can leptospirosis get?
So as I was saying, it can be from mild to just the flu-like symptoms to severe, such as kidney damage, which may present with like, for instance, darkening. Your urine might become a little darker. You may have reduced urine or no urine at all. It may cause damage to your lungs, so it can cause you to have like difficulty breathing, as I said, or you could start vomiting blood. Um, it can damage your liver, which when it gets to that stage, it's a little bit harder for it to be treated. And the more severe forms, the mortality rate is a little high.
Mhm.
Mm.
Mhm.
But the good thing, though, is that most people they tend to resolve after the first or the more mild um, presentation.
Okay.
And it's not contagious.
So it is not contagion. It's not sorry. It's not known to be contagious from person to person.
Mm-hmm.
However, it is contagious from animal to human being. So from the urine of a infected animal to the human being through their oral mucosa. So that's their either through your nose, your mouth, your eyes, or through like if you drink the water. So those are things that can cause you to get it.
Okay, so not contagious, so human to human, but pet or animal to human.
Mm-hmm.
Very, very interesting.
Mm-hmm.
All right, so let's look at the prevention. How do we prevent leptospirosis, Dr. Summer?
So,
Yeah.
for prevention, I would advise for you to avoid contact with flood water, stagnant water, and contaminated surfaces. So, you could use protective gear such as boots, gloves, pants and long pants and shirts, and waterproof dressings for cuts if it is that you're working in these type of environments, to control rodent population and maintain proper sanitation, as well as treating your water if it is that you have to boil it, or other forms of treatment according to guidelines, and to protect household water supply from these rodents as much as possible, as well as you could vaccinate some of these animals. However, that would be the veterinarians. But yes.
Oh, okay. Doctor Sommer, uh, is it still recommended to boil water though the hurricane has passed a few a few weeks now? Is it still recommended to boil the water just to be safe?
I would suggest that, because the so as a leptospirosis, the urine of an animal gets into that water. That water stays there for a good time, and people may be using this water. For example, I was volunteering in St. Elizabeth, so we were going into some of the communities, and you could see that there's a lot of people are using like the river water to bathe and to drink, and so there I would advise for this water still to be boiled, as I mean there's still rats and all of these things going on now, as well as the prevalence in Jamaica has gone up since the hurricane. So, according to recent reports from the Ministry of Health and other sources, from October 30th to November 20 of 2025, there were 9 confirmed cases and 28 suspected probable cases, and 6 reported deaths. Sorry. So, I would advise that the water is still boiled, as it is something that is ongoing.
Wow. And I know quite a few people, they use bottled water, so they go to the water store. So those water
I
be
would
fine?
recommend that, yes. I would recommend that that water be used.
Gotcha.
Okay, all
Okay.
right, wonderful, wonderful. Now, as we wrap, public health importance.
Okay.
Yeah.
So leptospirosis is it's common in tropical regions like ours, especially after storms and hurricanes. It is in fact a class 1 notifiable disease in Jamaica, meaning it's to be reported on suspicion or confirmed cases to immediately to the Ministry of Health. So prompt reporting helps us to track, investigate, and prevent spread, especially post hurricane. And early recognition reduces the risk of severe disease and death. So it is of public health importance.
Wow.
Hmm.
Mm.
So we all should just be aware. Be
Yes.
aware of what's going on and take the necessary
Precaution.
precautions so that we can all be safe.
Yes,
Yes.
correct.
And remember, if you use the regular water, boil it. Can we do
Yes.
anything else to it? I know.
Um, Honestly, I would have to. I don't have that information on hand right now.
I
Oh,
But
get
yes,
you.
yeah, I'm pretty sure there's other treatment options.
Yes.
okay. All
Yes.
right.
What's accessible to us is a stove or a coal pot or something.
Something.
Yes.
Boil the water. And is it recommended to boil it and let it sit for a bit? I don't know. Some people, but anyways, let's get it boiled so that we can get the water clean, so that we can use it until otherwise, reported by the necessary uh, personnel in the
Yes.
public
And
health.
and remember to also ensure that if you're working in these areas that you're wearing the necessary protective gear, if you have cuts, because as I said, the infection can get into the human being through those areas that you're protecting, that with like a water resistant dressing, so that you reduce your risk of getting this infection.
Okay.
Wow. Okay.
Oh,
Thank you. So
nice.
remember, it's not contagious from human to human, but animals to humans. The animals can pass it to humans. You have to be careful. And this is a bacterial infection,
Mm-hmm.
right? So you can get it from water, food contamination with urine from infected animals, etc.,
Soil.
etc. Yes,
Mm-hmm.
soil. So we just have to be
And
careful.
yes, and if it is that you realize that you're having any of these symptoms, especially if it is that you start having any jaundice, that is the yellowing to the eyes or
Mm.
to the skin, along with a fever, um, I would suggest that you seek medical attention. My offices are available from Mondays to Fridays. So from Monday to Tuesday, you can find me at Aviv Dental and Aesthetics. You can just make an appointment through WhatsApp, which is 876-822-5525. Or you can also find me at the health clinic on Wednesdays, that's in Penwood, as
Mm-hmm.
well as I'll be in Stony Hill on Thursdays and Fridays. Weekends
Okay.
again at Aviv Dental. I know that's a lot of
No,
information.
it's fine.
Aviv Dental.
Yes, and aesthetics.
Okay, that's
So
where
there,
again?
that's shop number 6, New Lane Plaza, Kingston. So that's in the halfway tree area,
Halfway tree. Okay.
on it's near to South Avenue Road.
Oh,
Mm-hmm.
yes. Now you say South Avenue. I know where that is.
Mm-hmm.
So again, you can WhatsApp her at 876-822-5525 for general medical consultations. You're saying?
And I'm also will be releasing another video today on the prevention methods
Awesome.
on my
Yeah.
Instagram. So that's Dr. Summer M as in man Graham. You can find some information there. So I'll keep posting there and educating the public as much as I can.
Wonderful. And
Mm-hmm.
I see that you're active on TikTok as well.
And instead,
Yes, I am. The same.
Yes.
hmm
Wonderful. Oh,
before you go, Doc, someone asked, is that some question? And I think they perhaps, I'm not sure if they missed what when you were sharing earlier. They're asking if rats are the only carrier of this
oh
disease.
no.
Okay. Yeah, so no, rats are not the only carrier of the disease.
Mm-hmm.
Other livestock,
Dogs,
cattle, dogs,
pigs.
pigs, thank you, all of those things are
Mm-hmm.
possible vectors of the disease or the
Yeah.
bacteria rather.
Yeah.
Yeah.
Mm-hmm.
I know we've been of the assumption that is the only rats, but
Mm-hmm.
wait, thank you so much for this
No problem.
information.
Yes.
No
It is
problem.
not only rats. Uh, you know, when we think about leptospirate rats,
Rats.
Yes.
it's not the case. It's not only rats. So thank you again. Anything else you'd like to add before we go, Dr. Summer?
I think that's it. Thank you for having me.
Thank you for
I'm
being here.
very appreciative of this opportunity to speak to the public about this current situation that we're having. So
Uh,
thank you.
Yes.
Thank you.
Thanks for
And
being here. I appreciate you.
yes, thanks for the info, Doc.
No problem. Thank you. Anytime.
Blessings.
Alrighty.
Okay.